15 silent signs your body might be in big trouble. Subtle clues, from handwriting to snoring, can reveal the earliest warnings of illness. Here is how to read your own distress signals. Do not ignore these symptoms. The human body can be truly incredible, yet totally bizarre. Your body even knows how to signal that something is not right with your health. Everything from skin rashes to a cough that just one quick could be a sign that your body is in trouble. Here is what to watch out for, according to doctors. Unintentional weight loss. If you have lost more than 10 pounds with no diet or exercise changes, get it checked out, says Richard Wender, MD, Chief Cancer Control Officer at the American Cancer Society. Unexplained weight loss happens most often with pancreatic, stomach, esophageal, or lung cancer. Damage to your teeth. I often get referrals from dentists with patients who do not feel heartburn or other reflux symptoms, but their teeth enamel is completely worn down, says Evan Dillon, MD, a gastrointestinal specialist at the University of North Carolina School of Medicine. Many are shocked to learn they have acid reflux. While sugary drinks wear down teeth at the front of your mouth, acid from your esophagus tends to dissolve the enamel of teeth at the back. Itchy, blistery skin rash. This reaction, which breaks out on the elbows, knees, butt, back, or scalp, may look suspiciously like eczema, but it could be a more serious issue. Celiac disease, an autoimmune condition in which ingesting even the tiniest amount of gluten causes your body to attack its own intestines. Up to 25% of people with celiac have this rash, known as dermatitis herpetiformis. Many patients have no digestive symptoms. When someone with celiac consumes gluten, the body releases an antibody known as IgA, which attacks the intestines. Sometimes IgA also collects in small blood vessels underneath the skin, triggering the telltale rash. Bowel or bladder changes. Peeing more or less than usual could indicate bladder or prostate cancer. Constipation or diarrhea may signal colon or ovarian cancer. You may attribute gasiness or bloating to your diet, but talk to your doctor if it lasts more than a week. Hemorrhoids. About 1/3 of patients with Crohn's disease, an inflammatory disorder of the GI tract, have a form that affects just the anal region. It manifests as sores, ulcerations, or fleshy growths outside the area, which can be mistaken for hemorrhoids. Patients will say sitting is so unpleasant. It is like they are perched on top of a marble, says David Rubin, MD, Chief of Gastroenterology at the University of Chicago Medical Center. This type of Crohn's disease is often the most painful and has the worst prognosis, says Dr. Rubin. If left untreated, Crohn's can lead to bowel obstruction, painful fissures, and even colon cancer. Changes in handwriting. When you think of Parkinson's, you probably think of tremors. But a more telling early Parkinson's warning sign is handwriting that gets much smaller. I have patients write a sentence such as, "Today is a nice day," 10 times, says Michael S. Okun, MD, National Medical Director for the Parkinson's Foundation. As they write, each sentence gets smaller and smaller, and the words become more crowded together. Random bursts of anger. For many people, depression does not translate to weeping or lying listlessly on the couch. More than half of patients with depression have irritability and anger. In fact, those depression symptoms are associated with a more severe, longer-lasting form. According to a 2013 University of California, San Diego study published in JAMA Psychiatry, netting coughs do not usually mean cancer. But if you develop a cough that won't disappear, even though you have never had allergies, asthma, or sinus problems, take note, it could be lung cancer, or if accompanied by hoarseness, cancer of the larynx or throat. Difficulty managing finances. One question we often ask: you're out to lunch, and the bill is $60. What is the 15% tip? Says Daniel Marson, PhD, Director of the Alzheimer's Disease Center at the University of Alabama in Birmingham. People in the early stages of Alzheimer's might struggle for a minute or two and then say, "It is $7." The answer is $9. While everyone has an occasional senior moment, it is a red flag if these issues persist on a regular basis, says Marson. As Alzheimer's develops, the brain's cortex, which includes areas involved in thinking, planning, and remembering, shrivels up. This makes managing day-to-day finances increasingly difficult. Snoring. It is a commonly known symptom of sleep apnea, which is associated with increased heart disease risk, but snoring may play a bigger role in cardiovascular disease than experts thought. A 2013 study published in the Laryngoscope found that even among patients without sleep apnea, snoring was linked with thickening of carotid arteries in the neck. Such damage is a precursor to stroke and heart attack. Snoring was more strongly associated with this wall damage than were smoking, high cholesterol, or being overweight. Unexplained bleeding. Any unexplained bleeding, coughing up blood, lung cancer, unusual vaginal bleeding, cervical or endometrial cancer, blood in stool, colon or rectal cancer, blood in urine, bladder or kidney cancer, or bloody nipple discharge, breast cancer, should be brought to your doctor's attention. Impotence. Research in the European Cardiology Review found a link between erectile dysfunction and heart disease. Arteries to the penis are smaller than elsewhere in the body, so they may become blocked even before a man has any other signs of heart disease. It is embarrassing. Many men just want to get a prescription and avoid discussing the problem with their doctor, says New York-based cardiologist Nika Goldberg, MD. But it is really important that they not dismiss it and get evaluated for heart disease. If men have other risk factors, such as a family history of heart disease, the doctor may recommend advanced screening tests, such as a coronary calcium scan. Inflamed gums. Gum disease could increase the risk of heart disease by 20%, according to a study in the Journal of the Indian Society of Periodontology. The link has to do with the body's response to inflammation, says Stur Fraun, DDS, Director of Clinical Research at NYU College of Dentistry. Frequent cleanings, every 3 to 6 months, by a dentist can usually control early-stage gum disease. Treating gum disease was associated with fewer hospitalizations among people with heart disease or type 2 diabetes, according to a 2014 study in the American Journal of Preventive Medicine. Frequent bathroom trips. When you start developing type 2 diabetes, your body becomes less efficient at breaking down food into sugar to use as fuel for energy. As a result, sugar builds up in the bloodstream, where it does silent but significant damage to blood vessels and nerves, says Ashita Gupta, MD, an endocrinologist at Mount Sinai Roosevelt Hospital in New York City. Your body frantically tries to dump the glucose buildup by flushing it out in your urine. You're going to the bathroom more frequently and producing much more when you go, says Dr. Gupta. You may find yourself getting up a few times during the middle of the night to pee. Since you're urinating so much, you may be thirstier, forgetting people's names. Spaced out on your neighbor's name at a barbecue? It may be due to stress or fatigue, but forgetfulness about little things such as names or grocery lists could indicate hypothyroidism, low levels of thyroid hormone. Patients complain that their brain just feels fuzzier. Without thyroid hormone, everything just slows down, says Dr. Gupta. I ask whether they still feel tired after a full night's sleep. If they still feel foggy, it may signal that something hormonal, like an underactive thyroid, is the culprit. Other low thyroid signs include always feeling cold, low libido, and food not tasting as good as it used to.